Good morning, everybody. My name is Lori Holtzclaw Hunt, and I'm the regional manager for the Gulf Coast area. And I'm a woman in long-term recovery. And what that means for me is that I haven't found it necessary to drink or use any type of substance since December 20th of 2006. The panel we are going to be discussing today is addiction during the pandemic, experiences and lessons learned. During this breakout, we're going to hear from Dr. Sharfstein, Dr. Wilson Compton, Josh White, Tatiana Work, and Kensington Oren. What we're going to talk about is the COVID pandemic of the past year affected everyone in some fashion or other. It has been presented a particular challenge for individuals in recovery. The panelists will discuss how the pandemic affected addiction and recovery in general. Both Dr. Compton and Dr. Sharfstein have studied and written about the effect on the pandemic on addiction and will discuss what they have learned. The other panelists are residents of Oxford houses and will discuss how the pandemic life in their Oxford houses and in the recovery community in general. Among other issues, the panelists will discuss Zoom recovery, room meetings, and telemedicine and consider whether these or some hybrids are here to stay. In what ways have they worked and in what ways are they inadequate? The panelists will also discuss other lessons learned from the experience and how they might inform future performance. And I just wanted to share a little bit about when all this started. I'm over 4 states of Oxford houses, and we were told that we were going to have to start doing chapter meetings, house meetings, state association meetings via Zoom. And I thought it was going to be an absolute disaster. I thought it was going to be very difficult for everybody to kind of get on board with it. But in all honesty, as the days and the weeks and the months went by, we really stepped up to the plate, and it turned out to be one of the most beautiful things because we were able to still manage and function and solve problems within our houses, our chapters, and our state associations. So give yourselves a round of applause for that because it was amazing. So our first speaker is going to be Dr. Wilson Compton. He is the Deputy Director of the National Institute on Drug Abuse, NIDA. Dr. Wilson is a nationally known expert on the causes and prevention of drug abuse. Before being appointed to this position in 2013, he was the director of NIDA's Division of Epidemiology Services Prevention Research since 2002. He has also served as a member of the DSM-5 Task Force and the Substance Use Disorders Work Group. Before joining NIDA, he was an associate professor of psychiatry at Western University in St. Louis and the medical director of addiction services at Barnes-Jewish Hospital. Dr. Compton.
Good morning. Well, it's really a pleasure to be here. I will tell you, let's see, I've been working remotely. I'm a government worker. My main job is to help support research from a distance. And I've been working remotely since March 15th of last year. This is the first conference I've been to, so it was very exciting to get in the car and drive here and see so many people here today. I'm so pleased to be able to join you in person after such a long period of time when we've adjusted to being in this two-dimensional square space for so much of our interactions. And I have a few comments I wanted to make, but I just wanted to start by talking about how, for me, one of the key issues in thinking about the impact of this pandemic on our field and on our lives is something that I learned a long time ago, which is a phrase that the opposite of addiction is connection. So how do we stay connected when we are literally asked to physically distance from almost everybody, from being apart, quite literally? Now, some of us did that by making sure we had, we were with a small group of people. Those we lived with became our local pod. But as we just heard, one of the ways that we've done this is by using technology to maintain connections. And I don't know about you, but I've been shocked by how useful and powerful using video technology and others has been to keep me connected with all sorts of people. Whether that's family at a distance, whether that's friends, whether that's support groups, colleagues. It isn't the same, but it's been helpful, and it's allowed us to continue. And it really, I think, shows the resilience we all experience and we all have had to rely on for the last 18 months. The other sort of issue is when this started back in March of 2019, I'm really glad nobody told me it would be a year and a half or 2 years or however long it ends up going on. We thought it would be just a few weeks. Actually, I don't know why I had that in my head. I'm a public health expert and I understand pandemics and epidemics, but for some reason, I really needed that idea that it would be short term. And I actually think that's part of what recovery is all about too, which is if you tell somebody you'll not be able to drink or use drugs for the rest of your life, that's not gonna work very well, is it? But if you say, how about today? Or how about, the next few days? Can you get through that? People will go, okay, I can deal with that. And I think that in response to this pandemic, we've had to rely on that same ability to focus on the current situation and just figure out how to get through. And then next thing you know, it's a year and a half later, we're now experts, I don't know, it's not just Zoom. I have had to learn Skype, Teams, Zoom, something called GoToMeeting that I still don't know what it was, but I used it once or twice. And all these other new technologies, just among other ways to learn how to get through the day and get our lives accomplished. I'm also struck that I've learned how to wear a mask and not be sort of horrified that my glasses steam up. As a physician, I certainly remember using masks when I did a surgery rotation. But as a psychiatrist, I really didn't have to pay attention to this during my work. And so even that little thing has been a major shift in learning and in adapting. Okay, that's just a little bit of background. But as I think about that background, I think that provides a context for understanding the impact on substance use disorders and recovery. What are some of the biggest predictors of relapse? Well, it's major changes, it's stress, and isolation. I just highlighted 3 things that are predictors of potential relapse. So I think that when we look around at the people we know and love who are in recovery, we can have compassion in understanding why this would be a particularly difficult time. That's what we thought when we were coming into this. So how do we tap into resilience? How do we make sure that we adapt our situation to do the best we can in these difficult circumstances? Okay, those general issues of social isolation, stress, changes are one major factor that we were all aware of. There are also major disruptions to our service delivery system. Now, in my world, that means disruptions to healthcare. Suddenly, you couldn't go to a clinic. You couldn't see a therapist in person. It's that two-dimensional world that we live in has not just been in our work and in our home lives, but it's also been in our medical care and healthcare and psychotherapy care, which is so important for many people with substance use disorders. It's essential. It's a life-saving part of recovery. That transition to either telemedicine or Zoom meetings or some internet-supported approach has been a major shift. And there's a real question about how well it works. Well, I'm a researcher. That's my job. My job at the National Institute on Drug Abuse is to support researchers at universities all across the country to answer important questions. Well, one of our important questions is, we've suddenly opened up the world to telemedicine in a way that it existed before, but it was kind of a fringe part of healthcare. Well, now it's front and center in the provision of behavioral health for almost everybody. So what's been the impact? We know that it's better than nothing, but that's a pretty low threshold. How does it compare to in-person services? Are there any advantages for some people in a telemedicine world? And I think that's been one of the, I think, key learnings as we've begun to accumulate knowledge about how this online service delivery works, is that for some people it's actually been a real benefit. There's some practical benefits. The folks that run very large behavioral health clinics have noticed their no-show rate is much lower. I think it's pretty obvious why that might be. To go to a clinic or go to a doctor's office prior to March 15, 2020, you had to either take a bus, get in a car, walk, if you were lucky enough to live really nearby. You had to go there, then you had to sit and wait. And then you had to do the same in reverse at the other end of your appointment. Well, guess what? With a Zoom world, an online world, maybe you show up a couple minutes ahead of time, but that's it. So if you have a 45-minute appointment, it might take 50 minutes. That is a huge change and a huge advance. The other potential advantage is that even if you're at a distance, you still might be able to access services. So we wondered whether this might help us reach more people in rural or remote areas. Now that's a double-edged sword, because if you live in a rural, remote area, how's your internet connection? Not so great. Even if we want to do it by telephone, even without internet-supported services, telephone service isn't that great in rural areas. So the technology divide and the digital divide represents an impediment for many people that are trying to access necessary life-saving services during this time. What have we seen in terms of what's happened to the overdose and the drug use epidemic during the pandemic? Did it stay the same? Did it get better? Did it get worse? Well, it turns out that there actually is mixed information depending on which part you look at. There's some very interesting studies looking at drinking by college students and by those between 18 and 22. When suddenly they went home, those that shifted from living in dorms or fraternities or sororities, living away from home and came home, actually their drinking diminished a bit. I'm not shocked by that, but I thought that was an important observation about how our living situation influences it. Those that had been at home and stayed at home, there was no change in their drinking, or it increased a little bit as they faced the stress. So that's one place where there might have been actually some positive benefits of the market change in the social situation. On the other hand, we've seen an increase in measures of serious drug use in many parts of the country. And of course, most concerning, we've seen a skyrocketing rate of overdose deaths in our country during 2020. We've seen about another 30% increase over what were already record-breaking and devastating levels of deaths of persons with addictive disorders in 2019, and we've seen them go up by another 30%. So our latest data from the Centers for Disease Control finds that something like over 90,000 people died of an overdose in 2020, and we don't see that letting up in 2021. Some of that may be the fact that one of the major reasons why people die when they overdose is when they're alone. And so there may be a direct impact of the social isolation with some of these overdose deaths. We've also seen a continued expansion of drug dealers selling fentanyl in all sorts of parts of the country that didn't previously have much fentanyl in their drug markets. Fentanyl, why is that such a concern? I'm sure you all have witnessed it, but as a pharmacologist and a physician, one of the ways I think about it is it's a potency issue. Fentanyl is about 50 times more potent than heroin. I've always explained this by using a baking analogy. All right, I have a cup of not flour, but heroin. If I poured it out on the out here, you go, oh my God. Well, first off, some people would start salivating, so that's a really dangerous thing. But it also means that you go, wow, that's a lot of doses of that powder. That will be packaged up into little envelopes or little glass vials or other ways and distributed to an awful lot of people in my community or elsewhere. Well, that's a cup. We can imagine that. That's kind of frightening, but that's a lot. How much fentanyl would be the equivalent of a cup of heroin? Well, if it's 50 times more potent, that's about 1 teaspoon. Well, let's see, 3 teaspoons in a tablespoon, 16 tablespoons in a cup, 48. That's how I get there. 1 teaspoon is a tiny amount. So you can understand why, if you were trying to divide that large amount into individual dosages, then trying to divide up that small amount of individual doses, why there can be such devastation just in terms of the unpredictability of our drug supply. It also explains from a market perspective, from a drug seller's perspective, why they might like it. Because it's a small quantity to smuggle and bring into an area. It also means you can dilute it a whole lot. It turns out it's a lot cheaper too. So there's many reasons why this would have taken over in so many parts of the country. But it has led to extraordinary death and devastation in so many communities. I'm also pretty shocked to see that counterfeit pills for benzodiazepines like Xanax and others frequently are actually fentanyl. And so we're seeing tablets sold on the street that are pressed pretty well to look pretty much like what you might get from your local pharmacy, but they're not. They are lethal dosages, potentially lethal dosages. And more recently, we've started seeing increasing numbers of persons who are using stimulants, also exposed to fentanyl. I really don't understand that, why drug dealers would, and maybe somebody can help me understand that. We don't do a lot of research with drug dealers. Most of my research is with persons who are in recovery, or persons who want to be in recovery, or persons who need to be in recovery. And so I don't really understand why you would mix intentionally or do it to sell products that people don't know what they're getting. But adding fentanyl to stimulants has become a major issue in many parts of the country. Okay, what do we know about the use of telemedicine services? We've done a few surveys and a few studies already, but this is an ongoing new area, so it'll take us a while to completely understand it. Something that really surprised me is it's not just internet-supported access to care. So people aren't just using Zoom, they aren't just using Teams and other internet support, but they're actually just using the telephone. And our financial system, whether that's Medicaid, Medicare, and others, is allowing that. And I think that's really important because it's sometimes difficult to establish a video connection with folks, but almost everybody has access to a phone. And so figuring out that we can use that to provide decent services for people is a key issue. Is it good enough to start care and provide all your care online? I'm a little skeptical about that as a practicing physician, but it may be much better than nothing. And so how do we balance better versus as good as it should be? And I don't know, and that's going to be some work that we'll be continuing in the next months and years. Now, while for me as an addiction specialist and public health official, I've been astounded by how much the addiction issues just faded into the background as we have completely focused on the COVID-19 pandemic for the last year and a half. And I think that's really unfortunate because it means that that's why we saw these market increases in deaths, and that's why we've seen such devastation in so many parts of the country related to substance use disorders. And I am glad that people are beginning to pay attention to it again, although I think it's unfortunate that the reason they are is because of the devastation. One of the things I'm looking forward to this panel is to hear about the direct impact on Oxford houses and on residential living of this pandemic. I have some ideas about what they might be, but I don't know. I haven't learned about it. And so I'm very excited to learn from our other panelists about the impact on their communities and on your houses all around the country. So that's what I had for you this morning. I'm very glad to bring a message of what I hope is hope from the National Institute on Drug Abuse. Our job is to bring the power of science and knowledge to answer questions that will help improve people's lives. And that's what I spend my days every day trying to figure out how to do as best I can. And I'm glad to be part of the convention today. And thank you for welcoming me today in person. Very exciting. Thanks so much.
So I just wanted to kind of say that if you all will be thinking about some questions that you may have after the panelists, we're going to do a Q&A session towards the end. And some of the things that we're talking about today, that is very strange to me. The fentanyl, where does it come from? In my day, I've been sober for almost 15 years. Drug dealers, they didn't really, they wouldn't cut another drug with a drug that was stronger. So it doesn't make sense to me either. So if you had someone out there that was selling, let's say heroin, they're gonna cut it with something less strong so they can make more profit off of it, right? So the fentanyl really doesn't make sense to me at all. It's kind of just really strange to me. The next speaker we have, he's coming in via video. He's Dr. Joshua Sharfstein, Director, Bloomberg American Health Initiative and Vice Dean for Public Health Practice and Community Engagement at Johns Hopkins University. Previously, he served as the Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of U.S. Food and Drug Administration as Commissioner of Health for Baltimore City, and as Health Policy Advisor for Congressman Henry A. Waxman. He is an elected member of the National Academy of Medicine and the National Academy of Public Administration. He works to develop and promote public health strategies, healthcare payment approaches, and regulatory policies that advance health and equity. So we're going to hear from Dr. Sharfstein.
Hello, Oxford House Conference. I'm Josh Sharfstein from the Johns Hopkins Bloomberg School of Public Health. And let me first say how much I wish that Paul Malloy has a speedy and complete recovery. And I really hope to see him and all of you next year. So I'm going to talk today about the epidemic in a pandemic, the overdose crisis in COVID-19. And we'll start by talking about the harm of the pandemic for overdose and addiction. And then we'll talk about what we can learn from the pandemic response, perhaps, to improve the situation with overdose and addiction here in the United States. So if you think about the risk of addiction being a combination of the individual, the environment, and access to drugs, the big impact, in my view, of COVID-19 was on the environment. The economic hardship caused tremendous stress. The trauma and grief of having people you love die or get very sick, or getting very sick yourself, caused tremendous stress. Problems with housing and food access, the isolation that was caused by the mitigation measures against the virus, all of that caused tremendous stress. And with that kind of stress, the environment gets worse for using drugs. And that's why we saw so many more relapses and people using drugs and getting into trouble with overdose. At the same time, COVID had other impacts. It reduced the amount of prevention that could be done as programs closed and were not nearly as effective, for example, with groups. And then you also had less access to naloxone as people were using drugs by themselves. So for opioids, there was less chance of reversal. And then many harm reduction programs like syringe service programs or outreach programs were interrupted or limited access. On top of all that, there were budget cuts for both mental health and substance use disorder in different parts of the country. You add all that up and you have record overdoses, more than 93,000 overdoses in 2020 alone. And you can see from this that there was actually an increase that was starting in the summer of 2019, but really accelerated during the pandemic. There's a Twitter account that you can follow at Overdose Updates that reports local changes local stories about addiction and overdose. And what it finds is that all around the country right now, things continue to be very bleak. So let's switch to what we can learn perhaps from the COVID-19 response to help with the overdose and addiction crisis. First, I think we can learn that national focus matters, that people pay attention when there's a true, strong national focus on solving a problem. And we saw a lot of interest in COVID-19, both from the Trump administration and now from the Biden administration. Wouldn't it be great to have a tremendous amount of attention to addiction and overdose so that people could understand how many lives are truly at stake? We learned from COVID-19 that data matters, that we could look at these dashboards for how your city or your county or your state was doing yesterday compared to the day before with COVID. Wouldn't it be great to have really good data on addiction and overdose that could really drive people's understanding of the problem and lead to support for the kinds of investments that are necessary, like in housing, like in Oxford houses, to make a difference? The medical system really mobilized for COVID-19. This is a picture of an intensive care unit being built in a parking structure. This is still happening now in Mississippi. The medical profession and the hospitals are very powerful. It would be great to have the whole medical system, from drug treatment to emergency departments, everywhere, totally engaged in helping people with addiction, linking them to services, providing life-saving medications, doing what's necessary to tackle a problem of this scale. And so if that were to happen, I think we'd see a lot more progress on addiction and overdose. And finally, resources. Who could have imagined that the federal government would be sending checks to every American? But that happened because of the economic crisis of COVID-19. And not just that, there's support for housing, there's more support for schools, there's a lot of support for food. And this graph shows the declines in hunger that happened when there were finally investments made by Congress in providing a lot of extra food resources for families. And so we know from COVID that it is possible to support the key needs that people have, to help them with their housing, their food, their job, training, other things. If we can do those things, then we'll obviously be more successful in helping people overcome addiction and stay away from overdose. And I think that's something that people in Oxford houses understand. Imagine having that level of support for the work that you're doing that has been brought to bear on COVID. So, to conclude, I would just say that the COVID-19 pandemic has been devastating, but it also offers some lessons for how we can do better for addiction and overdose. And I'm sure you'll have a chance to talk about that and have people react to that idea. And I look forward to hearing how the conversation went and seeing you again soon. Thank you very much.
So what Dr. Sharfstein brings up is very interesting to me, and what it makes me think about what it would be like if the overdose epidemic, the opioid epidemic, was treated the same as COVID-19. I think that if we ever get there, that one day we could probably combat the overdoses. I just asked Dr. Compton how many people have died of COVID since it started, and he said 600,000 people in the United States. And 90,000 people have died in the United States from overdose deaths over the last year, 2020. But I don't believe that is, overdose rates and overdose deaths are just here in the United States. I think it's also a worldwide thing as well. We just don't hear about that because a lot of other countries don't keep up with those types of statistics. So that's very interesting to me. Okay, so our next panelist is Josh White. He is an Oxford House resident in Florida. I would like to introduce Joshua White to this panel. Josh is originally from Thomasville, Georgia, and started using alcohol and drugs at the age of 12. Josh got sober following treatment at age 28. He enrolled in Florida State University and graduated with a bachelor's degree in psychology and a master's degree in social work in 1991. During this time, he got married, had 2 beautiful girls, and began working in substance abuse and mental health. Thanks to a 12-step program, he stayed clean and sober for 23 years, but began abusing opioids again after some time. Opioid use led to a return to drinking and loss of everything. He continued to use for 4 more years until he entered his first Oxford House in March 2019. Josh has wholeheartedly embraced the Oxford House model and has become active in service work for Oxford House, including serving as the Chapter 3 chair and the Florida State Association chairperson. He is about to embark on a new career path and will become our newest outreach coordinator later this month in Florida.
Thank you, Lori. She read it almost exactly how I wrote it. She left out the part about being happy, healthy, and handsome, though. Anyway, my name is Josh, and I don't like these things.
I know.
Anyway, my name is Josh, and I'm a person in long-term recovery. And what that means is I haven't had the need or felt the need to take a drug or a drink since June of 2019. And as Lori mentioned, I owe it all to Oxford House. I'm going to be brief, but I'll start out by saying a very wise person once said, "It's better to be silent and thought dumb than open mouth and remove all doubt." So at the risk of removing all doubt, I'm just going to share a little bit about my experiences in Oxford House and the COVID epidemic. How many here saw the video that Paul Malloy did at the outbreak of COVID? Do you remember what he said? It was very inspirational. He said that we at Oxford House can weather this storm much the same way we have weathered other storms. We were very resilient people. Look at y'all. 1,400 people, sober, clean and sober in one room. We can weather this storm just as we have weathered other challenges. And the message from Paul was very inspirational. We can do that together. Like I said, Oxford House has been a lifesaver for me. I've been living in an Oxford House in Tallahassee, Florida, since March of 2019. And earlier that year, I think, was our last state association meeting in person. And since then, all state association meetings have been Zoom or whatever, and we all know the challenges that Zoom faced, and I'm not the most technological person, but I like being here and meeting people in person. Zoom is just too impersonal. I like to be able to see you and talk with you. In Oxford House, we have faced challenges. We have had people who have tested positive. And there is a protocol in Oxford House that we all know about quarantining and so forth. But what I've noticed, because we have a gentleman in one of our houses right now who's positive, and he's quarantined, but we're stuck together. We bring him food, put it outside the door, and let him out on occasion, not very often. But it's support. Everybody in the house has pulled together to help this dude out. And hopefully on the 5th, he goes back and we'll start getting some negative tests. But the message that I really want to deliver is, as Paul Malloy said, if we stick together in unity, we'll get through this crisis, no matter what it is. And that's what makes Oxford House strong. And with that, I'm going to conclude the remarks, and I thank you very much for letting me be here and talk to you.
Thank you, Josh. And it is amazing that we've been able to quarantine and work together to get people in their own room while they quarantine, take care of them while they're sick. It just really shows how intelligent and how smart and how wonderful we are. I know that a lot of us come in and we don't have, I'm sorry, y'all. I'm an emotional person. We don't have a lot of self-worth, and, we don't think that we can do a lot, but we can. We are very strong people, and we're very intelligent, and we learn how to work through things together, and then eventually we can work through things on our own. And this pandemic has really showed us just how capable we are of doing those things. Okay, so our next panelist is Tatiana Work. She is an Oxford House alumni for Nebraska, and she's an outreach worker. Tatiana moved to Nebraska in June of 2019 from Arizona. On March 17th, 2020, she moved into Oxford House Stoley Park in Grand Island, where she has been fortunate to call home for the last year and a half. She began her Oxford House journey by serving in many service positions, including State Association Housing Services Chairperson. On July 1st, she was given the opportunity to gain employment with Oxford House in Nebraska. She is very grateful to have the opportunity to share her experience, strength, and hope to newly recovering addicts and alcoholics through other programs within the community. So I'll give you Tatiana.
Thank you, everybody. My name is Tatiana, and I'm a grateful, recovering alcoholic and addict. And what that means to me is that I have not had an alcoholic beverage or mind-altering substance since May 29th of 2020. So when I moved to Nebraska, this was really the last place that I thought I would end up in. Nebraska was not my choice. It was definitely something that it was kind of just offered to me, and I took upon it. But when I moved here, I slowly got myself into some trouble and moved into these houses right after treatment. When I got out of treatment after 28 days, I moved in, and it literally was like shut down with treatment. I was lucky enough that I did not have to quarantine when I was in treatment. Everything was still kind of on a normal basis. And then when I moved out, everything kind of changed. Going through the pandemic while being in these houses has been completely different for me. When I moved in, we were still doing face-to-face meetings. We were still talking to each other on a regular basis. We weren't doing Zoom right away. So it was really hard making that transition. And for my house, we've dealt with having COVID cases in there, and just like everybody was mentioning, like being able to come together as a house and be there for each other. Isolation was a really big deal. I've unfortunately watched a lot of people isolate to the point where they've left the houses because of relapse. I've watched a lot of friends outside of the houses relapse. And unfortunately, again, have been privy to people overdosing within our community. And it has gotten worse and worse throughout the year and a half. But with that, I still hold the hope that we get together as a community, as our community within Oxford House, to move forward in it. And slowly but surely, we're getting right back to not where we've been, but moving forward in it. We still participate in Zoom meetings. Some of our residents prefer that, and that's okay. But we also encourage us getting together and enjoying one another's company as we feel comfortable with it. It's been a struggle with it. because a lot of us came into these houses during the pandemic. So showing them a new way of that we used to get together, we used to have dinners together, we used to have movie nights and watch football on Sundays. I enjoyed it, I missed it, and I definitely tried to encourage it throughout the houses. I come from a rural area, so we have houses that are an hour away from each other, 2.5 hours away from each other. So for us to get together, it's kind of hard. But we make the best of what we can. The benefits that it's brought to the houses is that we've become more aware of it. A lot of us, like myself, have had the closed mind that this pandemic was never going to be this bad. That this was just going to be a scare and we were all going to do a little bit of isolation and then we were going to come right back to normal. And now going into it about 2 years, this is something real for us. But I know as being in the houses for the majority of the time during this, we're going to get back to normal slowly but surely, but we'll have that awareness. Really, that is kind of all that I have living in the houses during this time. And I appreciate being here to speak with you guys.
Thank you, Tatiana. Our next panelist is Kensington Oren. He is a resident and a regional association chairperson in Texas. Kensington Oren is originally from Pennsylvania. In 2014, he started his sobriety journey. During this time, he worked with a treatment court team, was on the Columbia Court Board for the Coalition for Addiction, and started a nonprofit called the Reintegration Initiative. Kensington relapsed in 2017, moved to Austin, and found Oxford House Identity. In April of 2017, he helped open a new Oxford House Stonewall. Kensington is currently the Chapter 21 chair and the South Texas Regional Association chairperson. He is employed as the director of events at St. David's Episcopal Church and is a social media personality. On September 7th, almost 4 years after moving into Oxford House, Kensington is moving into his own place, but will continue to give back to the community that provided him a purpose, a family which helped him to stay sober and assisted him in becoming the person he is today. Kensington.
Hey guys, God, hearing that, I sound like an overachiever. I maybe need to slow down a little bit. This is the biggest chapter meeting I've ever been to. This is ridiculous. All right, I'm Kensington. It's nice to be here. I have been sober since September 12th of 2017. I have also lived in, thank you. I've also lived in Oxford House since September 12th of 2017. And I don't think that those two are they're not separate. I'm absolutely sober today because of Oxford House and what it has given me and what I've been able to do in Oxford House. Service work is so important to our recovery, and it's just never ending service work in Oxford. So there's always something to do, always someone who needs help, always someone telling you to do something. I was voluntold about this about midnight last night, so bear with me. So the pandemic and how it affected my house, I think almost everyone who comes in and interviews for Oxford House, one of their things they tell us is one of their triggers is isolation. And I think that the pandemic was really good about isolating all of us from the AA fellowship, NA fellowship, but also from each other. I know that I kind of got a little isolated during the pandemic just because I was afraid to get sick. But also I just isolate because that's just who I am. I think one of the good things about the pandemic was Zoom. I actually really, really like Zoom, number one, because you can filter your appearance and you look really cute. But also because I was allowed to go to meetings that I got sober in back home in Pennsylvania. I was able to see all the people that I got sober with, and it actually was beneficial to me, and I actually really kind of enjoyed it. One of the downsides of Zoom is that I'm way more accessible, so that means more meetings in a shorter amount of time. So that was one thing. Let's see. I think one of the other things that came with the pandemic and Zoom was accountability for us. I think so many of us, send some of our newcomers to meetings with meeting sheets to be signed and things like that. And with Zoom, you couldn't do the same. You couldn't get the same amount of accountability that you could with an in-person meeting. I think along with that is the missing of the fellowship. I know for me, chapter meetings were an event, like food, fellowship, laughs, the meeting before the meeting, and then the meeting after the meeting. And then, COVID, and we lost it. And that, I think, was the thing that I missed the most, was getting together with my family, once a month on the third Sunday of every month, and coming together and sharing our experience, strength, and hope with each other. So, let's see. I think another loss was the houses being scared to hold interviews. I know for a while at my house, interviews were sort of put on hold for about a month or two, just until we figured out what to do. And then it became, phone interviews and Zoom interviews. And I don't know about you, but I'm not a huge fan of phone interviews or Zoom interviews. I'm much more of a vibe kind of person. So it definitely, for me and in my house, led to a lot of people, coming in who we didn't really get to know in the interview, because there's just not that same sort of connection that you get with someone who's sitting in your living room and telling you about their story. Let's see. I mean, that's all I really got. As she mentioned, I'm the director of events at an Episcopal church. Events sort of, took a back seat to COVID, and it made me more present in my house. I was there a lot more, and a lot of my other roommates were there a lot more, and we got to see a whole lot of each other. We got to hate each other a whole lot quicker, and we actually ended up bonding a whole lot more too. I think sometimes going to work, coming home, going to sleep, doing it again the next day, you don't really get to connect with the people you live with. And I think that one of the biggest benefits was getting to spend a whole lot more time with my family. Benefit and drawback, it depends on how you look at it, and on what days, and on who stole what, and who was feeling bitchy and who wasn't. I'm just so grateful to have been in Oxford at all, whether it's during a pandemic or not. It sort of makes me feel bad that realizing that some people only know Oxford through the lens of COVID, and that they've only been in Oxford during, the era of Zoom meetings, and they haven't quite had the experience of doing chapter meetings or inter-chapter meetings or regional meetings in person, because they really, I think that's my first chapter meeting, I think, is when I fell in love with Oxford the most. People getting together and just seeing all these potential dead people, getting together and just having the time of their life and just laughing and doing business, like taking care of stuff, was just very inspirational to me. And it makes me a little sad that a lot of people in Oxford today haven't gotten to experience that. So thank you for allowing me to speak. Thank you for volunteering me. And thank you very much for moderating.
Thank you, Kensington, for just really stepping up to the plate at the last minute. It was quite amazing, and thank you, Dee, for locating him for me. So I don't know about you all, but as I'm sitting here listening to everyone and thinking about when the pandemic started, I think in reality, we went through the stages of grief. So the stages of grief are denial, numbness, and shock. And then the second one is bargaining. I know that I was like, can we at least just go here, you know? And they're like, no, you can't go anywhere, you know, but why not here? Depression, I know I went through a lot of, you know, it was really hard, you know, to disconnect from everything that I've been doing for the last 15 years of my life, you know. Anger, I know everybody got mad. I was just, my employees that I supervise in the Gulf Coast states, we had to have several different types of Zoom meetings just so they could get out their anger and have somebody to vent that to. My poor husband, he's the one who got my anger from the whole thing. And then the last one is acceptance. And I think at some point we have gotten into some sort of acceptance with this pandemic. And it's not over. It's getting worse, in my opinion. I'm seeing a lot more COVID cases in the houses. And it's really, really, it's hard. It's hard to maneuver. What do we do? Do we go back to meeting? And we got to go back to Zoom. It's back and forth. It's quite challenging. So, I would like to ask Dr. Compton if you would like to come up and share a little bit about what you heard from everybody, or if you want to go ahead and accept questions. Can we turn this mic on right here?
We'll see.
Oh, there it goes.
Yes, it's on. Well, I'd be delighted to answer any questions, but I also have some questions for the rest of the panel too, because I'm very curious how the houses have adjusted and adapted during the pandemic. And one of the things I heard that was very interesting was you're interviewing people on Zoom before they come into the house. And I was struck that I've had to hire people purely on Zoom. We've got several new employees that I actually was shocked. We all met for coffee at quite a distance a few months ago. And first thing I noticed was, oh, that person's taller than I thought. And oh, that person's much smaller than I thought. Little things that you would just notice if you met them in person. But I've also been surprised that it's kind of worked. I thought it would be a disaster hiring people online and not meeting them. Turns out a job interview isn't a normal circumstance anyway, and people are stressed out and you're not really getting to know them. So it's not been I haven't noticed it being any worse. But I was curious what your experience is in bringing people into the houses during the pandemic, and has that created any unique difficulties for you?
Do one of you all want to come up and share about that?
Sure.
Okay.
I'm really good about talking. I'll just talk your ear off and about anything. So, for me, there were definitely a couple times, especially when people are in treatment, they know all the buzzer words. So they're hitting all of the right things to say, and you're not really getting the body language that indicates that maybe someone is not being as authentic as they could be. And I think we had at least 2 experiences where the person who was interviewing wasn't exactly the person who showed up at the door. So I think that it really sort of took away from that ability to really connect with someone on a energy sort of level, and really took away the ability to read body language, which I think is big with a lot of addicts. We all have golden mouthpieces that we can say anything. We've talked our way out of a lot of shit. But our body language doesn't really lie. And I think that you lose that in Zoom meetings or on phone interviews. So, thanks.
Good.
So I do want to just say, I don't want anybody to be diverted from Zoom interviews or phone interviews, because pre-pandemic, pre-opioid crisis, I was accepted into Oxford House from a reentry as on a phone interview. So I definitely wouldn't be here if they would have made me come to the house to interview. So just remember that. Does anybody, do you want to share? Okay.
Can I share
Come on.
something real quick? I've sometimes been accused of talking too much, but anyway, I wanted to kind of really piggyback on what Kensington said, because I, as Lori mentioned, got a master's degree in social work and worked with mental health and substance abuse for over 30 years. And I like that in-person contact, the body language, everything that goes into that, and it's so different now. And what scares me is I don't know we're ever going to get back to whatever normal was before. This might be the new normal, and that's something that we all have to adjust to. And I think, as I said earlier, if we stick together as recovering addicts and alcoholics in Oxford House, we'll get through this. But I had a question I wanted to ask everyone. How many people here used to do Unity events before COVID? What's happened since then? Yeah, we used to do a meal, and we would invite people from the other houses, and then we would play some really disgusting game like Cards Against Humanity. Yeah. Or loaded questions. And you know, you get a bunch of alcoholics and addicts in a room, and we just degenerate into, I mean, it's fun. It's great though. It's laughing. And this is what really, when I first got sober, I didn't think I'd ever have fun again. I couldn't use drugs, I couldn't use alcohol. My life is over. But I found I've had more fun and excitement and recovery. And in Oxford House, and in playing Cards Against Humanity and saying things I normally wouldn't say. But it's okay. Anyway, I just wanted to share that with you, but I'm afraid that COVID isn't going away, and this may be the new normal, but we can adjust to it, and we will survive, and we are going to be Oxford strong. So thanks, y'all.
That kind of leads me into a question for Dr. Compton. Do you feel like we'll ever go back to normal? Or what we knew as normal?
Well, of course I do. But the question is when. We thought at the end of spring that the infection rates were dropping and that things were getting better. We were seeing lots and lots of people vaccinated, which has made a huge difference in terms of saving lives and protecting people. It turns out we're not in charge, are we?
No.
And as one of my colleagues says, the virus will determine in terms of this infections when we go back. But I also say that I think in adapting to this situation, there may be parts of this that are going to be hard to unlearn. The ability, you know, I've heard, and I hope we can maintain some of the benefits that we've learned. The ability to attend a meeting that is 1,000 miles away at times. I'm teaching a class right now on Tuesday nights, and it turns out 2 of my students couldn't come to class because one of them has a child in daycare, and one of the other kids in daycare was COVID exposed. So suddenly the whole family has to stay home for a couple of, hopefully that's all they have to do is stay home for a couple of weeks. But through technology, at the last minute, I pushed some button and the classroom has good microphones and a decent camera, and they were able to join anyway. So even though we required it to be in person, I want it to be in person, and we will do it in person as best we can. But maybe we can adopt some of the technology to support us and be an advantage rather than just this pure one or the other. Now, it's a change though. And so I wouldn't want to hazard a guess too much.
So that brings me to our here and now, right now. There are some people that couldn't be here. So it is a huge advantage that we've been able to learn about the technology and video people in and Zoom people in so that they can still be a part of this convention with us. And that's, the kind of the same that you're talking about with the classroom, just because we can't, it's a huge advantage. It's something that we wouldn't have done before. If people couldn't be there, then we would have just canceled the class or the meeting or whatever it is, or they wouldn't have been able to attend. So I think that's a huge advantage. So I wanted to ask if you all had any questions. You can come up to the mic right here and ask your question to whomever you would like to address it to.
Hi, my name's John. I'm from Kensington, Oregon.
Hi, John.
Hey, Don. My question's for the doctor, and also I work in the recovery field, and what we're seeing is people with isolation, that they're not coming back, and we're losing them. Every time it shuts down with COVID, we shut our groups down, it goes on to Zoom, they're not doing it, and it almost just feels like people are trying to sell to do it online and stuff like that instead of in person, because as addicts, we need to have people, and just not for people in Oxford House, but other addicts. When it shuts down, we're teaching that's everything we learn is to, that not to isolate, we're being told to isolate. In my town that I'm living, I got out of treatment, COVID happened, and I'm grateful that AA stayed open every day, 7 days a week, no matter what anybody said, because I had that place to go. And I just know from my experience, it's very important that we all get together. What we do in our chapter is we do a cross meeting where someone's on Zoom and people, and we go ahead, and this is the first month now, we're meeting outside in the park and we're socially distancing so we can all socialize together. Now I'm finding people that want to make excuses not to go to it, and the problem is I see them at their treatment, I see them going to meetings, they're not wearing their masks, they're not doing this, but then they say they don't want to pretend of this because they're scared, And I think that we need more of a standard with Oxford. Also, my house, we do in-person meetings if we can, in-person interviews if we can, because we've had a train wreck of people come through, and then we can't get rid of them because of eviction. You can't evict to the rent, and then our house is suffering on money, and we didn't know what to do. When I came into this house, I had 3 people. Now in the last, I'd say it's been 7 months since we had 1 relapse in our house. But we've all gotten together and decided in-person is the way to go. And if we do it online, I check their background with an app, because I'm looking for honesty in what they've been involved in, because people will cover up and they only tell you a little bit. And we tell them, we want you to be honest with what you've been involved with. It's not what you've been involved with, but what you've done, and how you're working on your recovery.
So ask the question once again.
I really didn't have
No. Look, this is wonderful because it shows how frustrated that it can be to live in Oxford House during this pandemic, but also just how adaptable you and your house have been. And so a lot of times perception is a huge way of getting through, changing perception is a huge way of getting through things like this. Try not to look at the negative and look at the positive and how far you've come. So
it's actually answering the doctor's question.
Go ahead.
He wanted to know how we were doing with our interviews and stuff like that, in person, not in person, when he just asked that a minute ago. So I was answering his question.
Okay. I would want to amplify what you said is human beings need social interactions. It is an essential part of our life. We will perish without them. And so I understand what you're saying, and I see the advantages of in-person. I love the story about playing games and doing fun things in a large group. That's something we all benefit from, and it is part of recovery in a direct way, but it's part of life in a general way. And so I certainly don't think that our two-dimensional world is a full substitute. The question is, can it help us sort of muddle through in the meantime? And I guess to my mind, the question is, how long does this go on before it becomes a completely new normal versus, I still think of it as temporary, and I hope I'm right.
Thank you.
Yep.
Next question.
My name is Brent Collins. I'm from Goldsboro, North Carolina, one of the greatest states in the United States. Hey, that's what I feel. I've been in the Army and I've done some traveling. Well, to tell you the truth, I've been told I'm a little arrogant and self-centered, but then again, too, that is a good quality of mine. I was born that way, and I don't know too many people that don't like me, but I'm gonna get to what I have to say. And y'all gonna find out I am a little arrogant, okay? First of all, what I have been wondering, I was listening to him real clear, how this drug pandemic has gotten so bad because of this coronavirus. I mean, are people scared? They say, well, I'm gonna go ahead and commit suicide before, this coronavirus get me. That's one thing I can't answer, and I really don't think you all can either. And that goes to my mind every day. But I'm gonna get down to this. This might be why y'all might think I'm a little arrogant. I think I ought to be up there on that panel right there. I am very informative on how this coronavirus has affected a lot of addicts. I'm not gonna say I'm running the Oxford House, but I am kind of, up there, with my house. I don't want to make it too long. I don't want to prolong this, but I have things I have to say. I love Oxford House because it saved my life. That is the reason why I'm standing here talking to you right now. It is the reason why it's a lot of people that they're living today, and they have called me back and told me, said, man, if it weren't for you. But no, it was God. But I'm gonna get to what I'm really trying to say. This pandemic, some people might think I'm nonchalant about it. I'm not scared. I'm not passive about it either. But what worries me more than anything else is I can only speak for my house. Them guys have gotten more selfish I've seen any time. I mean, no, man, you gotta get your corona test. Well, that's okay. I mean, let me know if we're going too long now, right?
Well, I want you to go ahead and get to the question.
Okay, my question is...
Yeah, because somebody else may have a question that they want to ask.
Here. But what my question is, if you're living right, I mean, like I said, I'm not, like you all are sitting up there. I mean, are all of y'all really that affected by it? I mean, does it scare you that much? That's what I'm saying. All of us are addicts. It does?
The pandemic?
Yes.
Yes.
It doesn't scare me.
Okay.
As a matter of fact, I still have live interviews. I do it on the telephone. If 2 people leave my house today, I have 2 people in my house before their week's over with. I'm gonna say this and I'm gonna sit down. There's a lot of sick and suffering addicts out there, like I said. And for people that are addicts to change it, well, no, you can't come here, you gotta get the test, or this and that, right? They didn't bring me in there during the coronavirus. I've been clean 5 years, but I still, why we changing it for? I mean, I'm not scared, The drugs didn't kill me, so I don't think that can. That's all I have to say,
Thank you. Does anybody else have a question? Okay, go to the microphone.
Yeah, no, he was next, bro.
Oh, is he next?
Yeah, he was next.
A brief question. We only have a few minutes left.
Good morning. My name is Gerald Cole. I'm from Oxford House. I represent the Oxford Houses of Connecticut.
Hi, Gerald.
And 2 things. We've developed protocols for doing video interviews over Zoom or GoToMeeting. For example, we require a whole body posture, not just a face, and good lighting, good webcam. So first question is, do you have protocols for doing online interviews? Second, another issue that's come up is that people need to verify that they've participated in a meeting, 30 meetings, 30 days. So we have an online application form, but we also have the provisions for people to make journal entries and get to demonstrate verification that they've attended a meeting.
Okay.
Do you have a protocol for that or a digital solution for that?
We leave those decisions solely up to each individual house.
I would suggest that you would need solutions for both of those because I don't think people in general have the technical competencies to implement them.
Definitely something to look into. Thank you.
Hey folks,
Hi.
my name is Mitchell. I'm from Oxford House Kiwi from the
Hi,
great state,
Mitchell.
Sunshine State, Orlando, Florida. My question, I know everybody's talking about the coronavirus, but mine's more for the opiate addiction, and I'm an alcoholic, so I don't know a lot when it comes to the, looking at behaviors as far as when somebody's high on fentanyl or morphine or whatever it may be. Because at my house, I have a lot of addicts, and I've kind of learned from them and behaviors and stuff like that. And I would like to ask you guys how you guys could work with our local outreach workers and how to inform us as either chapter officers, residents, and how to address, like when somebody relapses on drugs and how to handle the situation. I've seen it both ways where people actually have some compassion and work with them, and I've had some people just be rude. It's, oh, you gotta get the hell out of the house, and it just makes matters worse. You know what I mean? Now, and I get it, in an Oxford house, everybody here knows the number one rule: you come in a house drunk or high on drugs or alcohol, you have to go. You have to pack your stuff up on the spot. You know what I mean? I says, well, what if they don't have nowhere to go? I mean, we just put them out on the street, Like, how do we handle this a lot better? Because nobody's really giving me like a tutorial or really, trained me on that. I mean,
We can definitely get with your outreach worker. Who is that?
His name is William Lott.
Okay, we can definitely get with him
Yeah.
to get some training for you. But Tatiana, do you want to come talk about that?
I do, because I've had a lot of issues come up with that, and it's not necessarily just within the house. I've had previous members that have relapsed, been expelled for the house, and then future-wise down the line still had issues. So, as everybody knows, there's a no tolerance for it, right? But the last thing I want to do is put somebody out on the street and they have no safe place to be. I make literally every ditch effort that I can. I call detox, requesting beds, and I keep those referral systems really close to me. So I contact detox, I contact the treatment centers, I contact hospitals. Worst case scenario, we have a hospital within our area that will literally come and pick up that person. Of course, not against their wishes, but we'll come and pick them up. And we'll hold them until detox is ready to take them in if there's not a place. We do have shelters that are available. A lot of the drawbacks on that is some of the places will not accept somebody who is inebriated or under the influence of, medications or drugs. But we have areas to get people to the help that they need if they don't have family, if they don't have friends, if they don't have a safe place to be. I don't want to send somebody out to a seedy motel where they're just going to continue doing the things that they're doing, because then it kind of weighs on me that the last thing I'm going to do is I'm going to find somebody in their room. Most recently, actually within the last 2 days, I've had to do a welfare check on a member of our house that left the house about a week and a half ago. And thankfully, we've caught it in time. But in the same sense too, in all else honesty, you're either going to want your recovery or you're not. And I can only push so hard for it, and I can only be there so much for it. But that recovering addict has to put that footwork into it as well. And if they want it, believe me, I will do everything that I can to get it for them.
Because the reason why I asked that question is because, it's hard to evict anybody out of a house. It breaks my heart really, because as an alcoholic, and just to send them back out there, because some people, they don't care. They'll talk this great game. I've seen it. I've been to different Oxford houses, and they'll be your buddy, and as soon as you screw up, there ain't no compassion. It's like, up, go.
Well, definitely you
know
could
what I
be a
mean?
person that helps find resources for people. That's what I always did. I was that person that tried to, help find resources. But unfortunately, we are out of time, so we have to get ready for the next panel. Thank you all for attending today. Thank you, Dr. Compton, and all the panelists.